Absolutely. So your thyroid gland, the master, it makes a variety of different hormones. And the ones that we really hear a lot about are T4 and T3 because they are in pharmaceutical form. So when you go to your doctor and your doctor is prescribing thyroid medication, or even when I'm working with patients and I'm like, yeah, you definitely need some thyroid hormone replacement here, that is in the form of T4 and T3. But the thing to remember is that T4 is inactive. So I know a lot of your listeners probably have a thyroid problem, been diagnosed. And if you ask them, what med are you on? What did your doctor give you? 80% of them, 90% of them are going to say Synthroid, Levo, T4. Now, in conventional medicine, that is the standard of care. You give T4 if someone has a thyroid problem, period, end of story. But my argument is with that T4 only treatment, there's so much more out there. There's so many different things that we can do to optimize someone. Why are we in this T4 only box? I call it the Synthroid box. Why are we in this box where every single person, and we know that we are all unique individuals, but we're treating every thyroid patient the exact same way? That is not going to produce optimal results. And those people think or are being told, like you said, by their doctor that they're normal, everything is fine, their labs look good. But meanwhile, if you ask them, they feel horrible. They're still gaining weight. They're not losing. They're fatigued. They're losing their hair. And basically, they're being told this is as good as it's going to get. But we know that that's not the case. So there are a variety of different combinations to thyroid replacement therapy, thyroid hormone replacement therapy, thyroid medication that we can do to get in some of that T3. So T3 is the active thyroid hormone. You have T4 inactive, T3 is active, and T4 has to convert to T3. So like you said in the intro, the liver is hugely important for the conversion of T4 to T3. If you don't convert that T4 that you're taking or the T4 that your thyroid gland is making, if you don't convert it over to T3, nothing gets done. You don't have a metabolism. You don't feel good. Your hair continues to fall out. You have anxiety and depression and sleep disturbances. And the list goes on and on when someone isn't optimized in their thyroid. So T4 has to convert to T3. So yes, we can use T3 in the medication form to actually start to move those numbers and improve that T3 number that we can test on labs. So the thyroid produces T1, T2, T3, T4. T4 and T3 medication. Now, you can also find a little bit of T4 and T3 in glandular supplements. And that's the beauty of glandulars, is that if someone is stuck on T4, they're stuck in that Synthroid box, we can use glandulars, which I absolutely have done with my patients, to improve their thyroid function, improve how they feel, because that natural glandular contains a little bit of T3. It contains a little bit of T2. It contains a little bit of T1. It contains all of the thyroid hormones in that glandular. So that's the beauty of over-the-counter supplementation, like your thyroid supplement that's going to be coming out. That's going to be a game changer. Then we move on to the other thyroid hormones, T2 and T1. T1 we'll just push to the side. It's not that active. We don't really pay attention to it, and it's not studied very well. T2 actually has some studies on it because somebody at some point in time said, hey, wait a minute. There's this other thyroid hormone that we're really not looking at. And it's not in a pharmaceutical form. You will get a sprinkling of T2 if you're taking natural desiccated thyroid, so NP thyroid, Armour thyroid, any of the NDT categories. You'll get a little sprinkling of T2, but it's not in the microgram amount that can really make a difference on the body and that can produce the differences that these studies are showing us about T2. So when we're looking at T2 and we're looking at the studies, they're really quite phenomenal. And of course, I have a theory that the reason why we don't have more studies on it, we don't have more human trials on it, is because it is not in pharmaceutical form. So the drug companies aren't making money if they can't prescribe it, but it is in supplement form. So in supplement form, studies have been done that shows, I'll just give you kind of the brief overview and then we can dive into it. Increased basal metabolic rate. So literally the amount of fat that you are burning sitting around, doing absolutely nothing. It is increasing your basal metabolic rate. And a lot of people call it, even the researchers are calling it exercise in a bottle, because it mimics the effects of exercise while you're just sitting there. Now, we're not saying not to exercise because we still want you to do that for your health, but it is mimicking those effects. And the unique thing about it as we compare it to the active thyroid hormone T3 is that it only has a propensity for burning fat. It doesn't touch your muscle. Now, T3 is fantastic. It's fantastic. It's active. It's fantastic, but it will burn off your muscle tissue. So if T3 will burn fat and muscle at the same time, T2 just burns fat. It leaves muscle alone. And in fact, some studies are showing that it stimulates the muscle tissue. So that exercise in a bottle saying is also not just for burning fat, but it's also for stimulating muscle and just a little bit of muscle growth. Now, you're not going to be a big jacked up bodybuilder taking it, but you are going to get some muscle stimulation as well as brown fat activation, which also makes us more metabolically active, which also helps us burn more fat, which improves our mitochondria and ATP production. So T2 does so many different things. So you let me know what path you want me to go down next, but it's pretty exciting when you really look at the studies.